Today, I've got a great guest joining us right here in the Villages. As many of you know, this community is all about staying active, social, and enjoying life. But the big question is, how do we keep doing this, not just for years, but for decades? Joining me today is David Meinz, a nationally recognized health expert, registered dietitian, professional speaker. He spent decades helping people improve their health, energy, and longevity. He's known for breaking down what really works, and when it comes to adding not just years to your life, adding life to your years. David is now teaching at the Enrichment Academy. What he's teaching is a class called 10 Bonus Years, and that's based on a book that David has written, which is one of several from what I understand. David, welcome to the show. It's great to have you here on the podcast.
Thank you, Tom.
So, David, tell us a little bit about your class, too, that you're teaching here.
So this is the third time I'm teaching it. We offered it usually twice a year in the Enrichment Academy. It's a 4-week course based on my book, 10 Bonus Years. And this afternoon will be our last one in this series of 4. So this will start us, and then probably, I think we've scheduled for January of 2027 for the next one.
Okay, so January 2027, you might want to get that on your calendar, and we'll have contact information from David here later in the show. So David, you got some slides you want to show us today, and give us that first one. Let's.
So, Tom, I always like to start out with a question, and that is simply, what do you have in common with these 3 villagers right here? We've got Andy, we've got Andrew, and Linda. And the answer to the question is, they thought everything was fine too, and then they died. Just to give you some of the details, Andy Anderson was a 14-year resident here in the Villages, and a couple years ago, he had a massive heart attack. He was 79 years old. Linda Lincoln was a nurse practitioner, lived in the Villages, had a heart attack in her home, and died at age 73. And you know, in the Villages, these are not old ages necessarily.
Correct.
And here's even a younger one. This is Andrew Curtis, lived in the village of Mallory Square. He actually was running for the Florida State House. A friend of his, Cliff Weiner, said, he was president of a property owners association, said, "He was my friend and a fellow board member. I am stunned," was his quote. Andrew was just 69. And the point is, most people are stunned to find out that the biggest killer in the Villages and in the United States is a surprise heart attack or stroke. And that's what I dedicate myself to in terms of what I do. It's the purpose of my 10 Bonus Years course. It's the purpose of the event that we're bringing again to the Villages at the end of this month. And that is, how can you see a heart attack or stroke coming better than what's currently offered? Now, we have a great medical system, but it's primarily a sick care system dedicated to helping people stay alive after they're sick.
Right.
Surprisingly, only about 40% of the people don't make the ambulance ride. If they have a heart attack or stroke, about 40% don't even make that. We want to improve those odds by keeping you out of the healthcare system. And so there's new technology out, and it's better than a stress test, and it's better than most blood work, and that's going to be one of our topics today. It's called the CIMT test.
Okay.
CIM, that stands for Carotid Intima-Media Thickness test, and it's a neck artery test. And the reason we look at the neck arteries is it's so much easier to look at those than look at the arteries of the heart. And there's a 95% correlation between your neck arteries and your heart arteries. If you are healthy in the neck arteries, no plaque, 95% chance you're clear. If you have disease up here in the neck, you probably got it here in the heart. But this is much easier to get to, no radiation. You don't have to go to a hospital to have this test, and it's relatively inexpensive as well. So that'll be one of the things we're talking about today. This is just one more thing I found in the news recently. A golf cart driver likely died of a heart attack in Lady Lake, 71-year-old man. Now, that man's younger than I am, Tom.
Yeah.
What's going on here?
Not too far from my age.
Exactly. And he was found dead Wednesday beside his golf cart at the bottom of a dry retention pond. Probably died of a surprise heart attack as well. So the good news is that we can do something about this, but you have to know what's going on. Otherwise, you won't take any action.
So in doing this test, what does somebody do with the results of that test if it's not, up to par?
Right. So first of all, you will take action. You won't take action if you don't know there's a problem, because
sure.
there's no symptoms. See,
Yes.
that's the deceptive part of this disease is, Tom, the most common first symptom that you have something wrong with your heart is that you die.
Yeah, well, that's not good.
That limits your opportunities. Again, that's amazing to think that, most people think, well, I'll have chest pain, so I'll go to the doctor or something. Yes, that can be. And a lot of people say, well, as soon as you see symptoms, well, I would say don't wait for symptoms.
Yeah.
That's kind of late in the game.
Yeah.
So what we're talking about is once you find you have this problem, what are you going to do with it? Well, believe it or not, there's not a lot of opportunities out there. I work with a group of physicians that really are proactive, what I call aggressive prevention, which is more than just taking a cholesterol drug or telling you to exercise and eat right. Everybody knows that.
Yeah.
Right. So that's the first thing that we want to do is find out if you have the problem, and the new technology can see it years before traditional testing can see it.
What age would you recommend people start getting those tests?
I had a man and his family, his wife, and his son. The husband was in his 60s, the wife was in his 60s, and the son was in his 20s, and the son already had disease in his 20s. And the mom had disease, and she was a tiny little thing and looked like couldn't possibly have any problem. And here's ironic, too. This is ironic. The husband was very overweight and was clean arteries.
Oh, yeah.
So you can't tell what's going on inside by what you look at on the outside.
Yeah, because that's one of the things that a lot of us think is you're heavy, that you're definitely a candidate for a heart attack, and not necessarily the case.
The odds are good you are,
Yeah.
yes. But just because you're a tiny fit woman who eats right doesn't mean you're clear either. You've got to take more action than just, I think I'm okay.
Yeah, and even if you were a large person and you've lost significant amount of weight, that's put you in a better category for a lot of other things, but that does not reverse clogged arteries.
It does not, yes.
Yeah.
That's right. So the story I like to also point out is of Tim Russert. Do you remember the NBC newsman Tim Russert?
Yeah.
So
died very young. He
did. He was on good care, the best care available, as a matter of fact. His doctor had him on a cholesterol medicine. He was on aspirin, an ACE inhibitor for his blood pressure. He got his cholesterol numbers where his doctor wanted him. He was very happy. He went in and had a stress test. He passed the stress test, and he died 8 weeks later at work from a surprise heart attack, age 58. How does that happen? We now know how that happens, and that's some of the things we're going to talk about today. So remember NBC's Biggest Loser, fitness guru Bob Harper.
Yes.
Eats better than you and I do, Tom.
Right.
Is more fit than you and I are, and had a heart attack at the gym at age 51. And frankly, if there had not been two physicians there on site, he probably would have not made it. And the point is, everybody said, well, there's somebody who's in great shape. He's got nothing to worry about. Again, you can't tell what's going on inside by how you look on just the outside.
Well, remember Yul Gibbons? We all thought he was a healthy eating character, too.
Right.
He died young. Yeah.
That's right. So this gentleman you don't know, but he's my brother-in-law. His name is Scott. At age 45, he had chest pains, and they put him on a treadmill for a stress test, and he passed again with flying colors. And so they asked him if he had any stress, and he said, I'm an American. Yes, I have stress. So my sister said, well, we're thinking about going down to the Ozarks. They live in Missouri. We're going to go camping with our little girl. Would that be good? Oh, it's exactly what you need. Relax a little bit. Get away off all this stress.
Yeah.
And as you can imagine, at 2 o'clock in the morning in a driving rainstorm one evening, my brother-in-law had a heart attack. And now my sister has to get everything together in a car in the woods. She doesn't really know exactly where she is. Try to find a hospital somewhere in the Ozarks. My little niece is crying in the back because she thinks her daddy is dying. And they put a stent in and, quote, saved his life. And they did. But I'm not going to give him 100% credit because it's that same medical community that 1 week earlier told him that everything was okay.
Yeah.
This is good. This is Dr. John Warner. He was the past president of the American Heart Association. And while he was attending the annual conference of the American Heart Association, surrounded by thousands of cardiologists. He had a heart attack at the American Heart Association convention. The cardiologist had a heart attack at the American Heart Association, surrounded by thousands of cardiologists. He was 52 years old. My point is, maybe they don't have all the answers. There are certainly good, qualified people that can help you once you have the event.
Yeah.
But maybe they still have some things, as we all do, to learn. Luke Perry, the actor, you remember him? He had a stroke, and he was just 52 years old.
Right.
I mean, a strapping guy like that, on top of his game, and then gone. And it's not just men, Tom. This is important for our listeners, I think, to realize as well. You remember Debbie Reynolds, of course, and her daughter played Princess Leia in the Star Wars.
Correct, yep.
Carrie Fisher.
Yep.
Carrie Fisher got on an airplane in London, and by the time she got to Los Angeles, she had had a heart attack, and she died at age 60. And ironically, the next day, her mom had a stroke and died at 84. Both of those are cardiovascular events. Stroke is a disease up in the brain. A heart attack is a disease down in your heart. And I don't think Carrie Fisher, when she got on that plane in London, thought she wasn't going to make the trip.
Right.
Because there's no symptoms.
Right.
Susan Lucci, a lot of people know this daytime star.
Yep.
There's a picture. She looks pretty good for 71. Ate the Mediterranean diet, practiced yoga, is physically fit. She had a 90% blockage in what we call the widowmaker. Women can have the widowmaker as well. It's the left anterior descending artery. And she had to have emergency surgery to survive and save her life. So something to consider, women in heart disease, a woman is more likely to die from a heart attack than a man is. Heart attacks and strokes kill 420,000 women a year. All forms of cancer, uterine cancer, breast cancer, pancreatic cancer, lung cancer, all of them together only kill 270,000 women a year. And I think a lot of women still think breast cancer is their big issue. That's what they're really afraid of. And you must do mammography, yes. You must do breast self-exam, but you're missing the point if you think that a heart attack is your husband's problem.
Yeah.
It's an American problem. So 64% of women who die suddenly of cardiovascular disease, no previous symptoms. 64%.
That's a big number.
And it's only 50% in men. It's much better. It's only.
Only.
So in other words, again, the most common first symptom you have something wrong is that you die. And we got to fix that. That can't go on.
No, it got to be, we need a little more warning.
And that's with the current medical situation. That's with all the best medical care we got, it's still 50%,
Yeah.
We got to do better than that. So as you can see in this chart right here, your breast cancer in the blue line goes up slightly as you get older. But the red line is what you need to pay attention to. That's your risk as a woman of having a heart attack or stroke once you get past menopause. Because once you get past that protection of hormones that you naturally are producing, like estrogen, then that goes away and you start playing by the same rules that most men do in this country, which is if you did a man's chart, that red line would look the same, but it would start about 10 years early.
Yeah,
yes.
okay.
And that's why it's incorrectly thought of as a man's problem. So women during heart attack symptoms, one of the reasons they die more likely than a man does having a heart attack is they don't look like they're having a heart attack. Women have shortness of breath. They might have abdominal pain, sweating, but in almost half of them, there's no elephant sitting on their chest like it is for a man. And so they go to an emergency room. They know something's wrong, and somebody sees those symptoms and thinks to themselves, anxiety attack. Ma'am, would you wait over here, please, while I take care of this man who's having a heart attack? And she's having one too. And that's why when a woman has a heart attack, she's less likely to survive. Women 1 month ahead of time actually often demonstrate some symptoms: unusual fatigue, sleep disturbance, unexplained anxiety. And a lot of the ladies watching today might be thinking, oh my God, I'm going to have a heart attack in 1 month. Because that's me.
Yeah.
You can have those and not have a heart attack, but that is some of the things that we do see sometimes 30 days before an event happens. So women who have had high blood pressure or diabetes during pregnancy, they have a lifelong elevated risk of having a heart attack or stroke. And physicians rarely ask about that. They rarely ask, did you have high blood pressure during your pregnancy? I bet that question hardly ever comes up. And yet that is clearly an increased risk. Or did you have what they call gestational diabetes when you were pregnant? And rarely does a woman ever hear that question.
And do all those things relate back to clogged arteries?
Indeed.
Okay.
Yeah, that's it exactly. Diabetes, high blood sugar, is a major initiator of the disease that happens in the arteries. It tears up high blood sugar and high insulin levels, tear up that thin little layer that separates the blood from the rest of the artery. And when that happens, then you have the opportunity for the plaque to start forming. So one of the things I talk about in my class is that we've got to control blood sugar and insulin levels, and hardly anyone measures insulin. I bet hardly anybody listening has ever had their doctor say, let's measure your insulin, unless they have diabetes, and then it's kind of after the fact. We want to do something before that happens. Yeah. And so high blood sugar, but high insulin levels as well, and your A1C, which is the 3-month average of your blood sugar, or a finger prick when you go to the doctor's office to get your fasting blood sugar, are terribly outdated measurements of your health. Because what happens, Tom, is a lot of people don't realize this. Your pancreas, which produces insulin, can be working overtime for 20 years to maintain those nice blood sugar levels when you go in the doctor's office. But many people, I think, can relate to this. Their numbers are always good. They tell me, oh, my blood sugars are always good. And then the next time they go to the doctor, he tells them, you're diabetic. What? How did I become diabetic from one office visit to the next? Well, you don't become diabetic in 6 months. You become diabetic in 20 years. But if all you're doing is getting a finger prick or looking at your A1C 3-month average, it doesn't see that the pancreas is about to wear out from doing its job to maintain everything.
Yeah, everything's been working full steam to keep you from being one, but that stuff is now wore out, or
the beta cells of the pancreas literally cannot produce insulin anymore, and you give them the diagnosis diabetes. Now, you can live a long, healthy life as a diabetic, but boy, it's pretty tough, and there's a lot of side effects. Much better is to prevent it. Here's the thing, though. The CDC says about half of adults, are pre-diabetic right now. Half of them. I am. Many people are, and I'm not overweight, and I exercise, and I do everything right. But unless I knew what to look for, I would never know that I'm pre-diabetic, and setting myself up for diabetes in another 10 years if I didn't do something about it. Lord willing, now I can beat this thing. You don't ever have to become diabetic. You will if you take no action. Yeah. So we'll just go on with a couple more here. So the bottom line is, as a woman, you have to be even more proactive. You just can't assume everything is right. And again, his national survey, only 44% of women identify heart disease as their top killer of women. We got to do better than that. Hopefully, maybe this message will get out a little bit today. So I always ask the question, Tom, you probably know, you've probably heard stories of somebody that pretty well did everything right?
Sure.
Exercise, marathon runner, vegetarian.
Yeah.
And then you hear, hey, did you hear about Joe? What happened to, no.
Good friend of mine, we used to live in Georgia, and swam all the time, exercised all the time, always ate fantastic, always, I thought, great shape.
Yes.
62 years old, had a major stroke, and he's still alive, but it's totally life-changing.
Yes, it is.
Totally life-changing. Long time for rehabilitation. So yeah, absolutely, I've seen that. Same thing with younger people. My son-in-law's younger brother died of a heart attack at 46 years old.
46.
Yeah, and so yeah, it does happen, and we'd like to find ways to prevent that from happening.
Well, and the incorrect response to that for many people is, well, I guess you just never know. Or even worse, I guess God wanted him in heaven.
Yeah.
He wanted another angel.
Yeah. only the good die young.
Yeah, that's so wrong on so many levels. We can see this disease coming 10, 20 years ahead of time with new technology, the CIMT. We can see that coming, but you got to get tested to find out if you got it or not. I have it. I have disease. My dad died at 56 from a heart attack. His dad died young too.
Yeah, so you definitely, hereditational type issues are very prevalent.
They are. And it's about 25% of the outcome. It's the biggest single factor. But what I like to tell people is genetics is your tendency. It's not your destiny. And so, yes, if you take no action and just breeze through life, genetics will probably determine what's going to happen to you. But I mean, I don't choose to live my life that way. We know so much now. We don't have to be a victim of our genetics. 75% is pretty much up to us. That gives me a lot of hope that I can do something about this.
It gives you a lot of leeway to be in control.
Right. So, as an American, either you're a woman or a man, your highest health priority is to prevent a surprise heart attack or stroke. That's our message today. And you can get urgent care. I actually took this picture as long as it's between 8:30 and 4 p.m.
Yeah. Yeah. As long as it's convenient for everyone else.
I thought that was pretty good.
Yeah.
And again, 40% don't make it to the hospital. If you call the ambulance, you call 911, 60% chance you'll make it, but I don't like those odds. So we were actually making progress. Deaths from heart attacks and related conditions fell 69% between 1950 and 2009. We were getting control of this thing, but now it's reversed again. It's going back up again. Deaths from heart attacks and strokes are going back up again. One of the reasons is 42% of Americans are obese, 30% are clinically overweight. That's 72%, Tom.
Yeah.
So when I graduated in 1981 with my master's degree in nutrition, 25% of Americans were struggling with their weight. 25%. Now it's 72%.
Yeah. Yeah. What do you think of the GLP-1 situation?
I think there's a place for it. I like to tell people, if you are 300 pounds and you've been struggling with your weight for a long time and you want to try these medications, if you're willing to exercise, and most people don't like that part, but here's the thing. We know that if you go on the GLP-1s and you don't exercise, you lose a lot of muscle as well as fat, which means when you lose, let's say, 50 pounds, and most people will gain it back if they get off the medicine. If you gain 50 pounds back, people say, well, I'm back where I started. Well, wait a minute.
That's fat.
Yeah. You don't gain a whole lot of muscle back.
Yeah.
And so as a result, you're worse off than you were before because you're fatter now, even though you weigh what you did before.
Yeah.
So it's a serious thing to get on these medicines. Number one, they can be expensive if you don't have the right coverage.
Yeah.
And you got to do lifestyle, which of course is the underlying issue to begin with. But yes, if that'll give somebody the head start they need to turn their life around, and they'll say, yes, now that I've lost 50 pounds, I want to keep it off, so I'm going to change the way I eat, and I'm going to change my activity, I think I can live with that. Yeah, as a dietitian, I think we have to do what's necessary. I will tell you, though, that in my 35 or so years in this field, I've seen a lot of medications come and go. This one seems to be different. The GLPs seem to be different because they actually decrease hunger, and they give a feeling of satiety. You're more satisfied when you eat, which is the big issue, isn't it? Because that's telling you that the reason these people are overweight is because they were eating so much. So when you deal with that, you can actually start losing some weight.
Yeah. It's a lifestyle change. I'm on GLP-1.
You are, okay.
I made a lifestyle change when I moved to the Villages. I've been self-employed my entire life, but people would never recognize what I used to look like. So,
how much did you used to weigh?
160 pounds lighter than I used to be.
Wow. And in your opinion, what was the reason for that gain over all those years?
I've been self-employed my entire life, had many stressful situations.
Yes.
I owned a Chevrolet car dealership, my last job.
Wow.
And very stressful. Not being able to exercise the way that I should have, just due to time constraints, etc. But no, I took it as a second lease on life. When I got here, I lost 95 pounds without GLP-1, and have been on that to maintain and get where I'm at. And it is a lifestyle change.
Yeah.
I don't look at food anywhere close to what I looked at food before. It has a totally different meaning in my life.
Yeah.
So I'm a firm believer of it, at least at this point.
Yeah.
And I'm not on a high dose. I don't plan on. I probably will stay on a low dose as long as I think is necessary. Maybe it's forever. I'm not sure. My doctors are at the Cleveland Clinic, and very supportive of it. Think the same thing, that it's the benefits right now definitely outweigh the harm. So
if someone weighs 300 pounds and takes no action, or what they've done hasn't worked, I can predict their future. I can't tell you when, but I can tell you what is going to happen to that person. There'll be a heart attack or a stroke, certainly high blood pressure, probably diabetes. All of that is in the future if they don't have it already. So let's take some kind of, if you will, dramatic action, and the drug is, if you will, a dramatic action. But like you, you're a testimony to doing this with lifestyle at the same time. Good. That's what it's designed for.
Yeah, like I said, it wasn't I don't think it was around when I started this journey. It's been 7 years to go from where I was to where I am now. So it wasn't overnight, and it's definitely a lifestyle change. And I didn't have high blood pressure. I wasn't a diabetic, which was amazing. I didn't have any joint problems, which was amazing.
Yeah.
Consider myself very fortunate to not have those.
Yeah, yeah.
And now I'm 63 years old and definitely at the weight that I think I should be. So
Good. Congratulations.
Yeah, thank you.
Wonderful. That's wonderful. Good. Well, yeah. So just to bring us back to what we were talking about, death rates from heart disease in adults 45 to 64 is up about 9%. Every 25 seconds, an American will have a heart attack. Every 25 seconds, every minute, someone dies from one in the United States. So for our little bit of time here, 60 Americans are going to die in a little bit of time here. I can just tell you that one event that happened way back in 1978 with my dad changed my family. We were never the same again because our family wasn't there anymore.
Right.
I lost my dad when I was a young man. My sister was just a teenager. It's tough enough to be a teenager than to lose a parent.
Exactly.
My mom became a widow at 52. That's too early to become a widow. Yeah. So multiply that by the 60 that are going to die just in the time you and I are talking here, Tom. And then you can see what an impact this has. Every 40 seconds, someone in the United States has a stroke. And 90% of that, like your friend, results in some kind of degree of paralysis. I think some people are more afraid of a stroke than they are a heart attack, because a heart attack can be a life or death situation. A stroke, you might survive and now be dependent on somebody for the next 20 years.
There are worse things than dying, and that could be one of them. Absolutely.
That's it, exactly. I don't know if you've ever been to the Vietnam War Memorial in Washington, D.C.
I've been to I've been to where they've replicated that.
Good. Yes. So in Washington, D.C., it's the number one tourist attraction in the nation's capital. I was pretty excited to go up there because I thought it was going to be some beautiful piece of architecture. When I got there, I was a little disappointed because it's just a wall with names on it. But people aren't coming to see the wall. They're coming to see the names. And there's 58,000 names on that wall. Yeah. And, we have very convenient wars these days from a distance. But back then, that made an impact. That tore this country apart.
Exactly.
The riots in the streets, the campuses, on everything.
Yeah.
And yet 58,000 boys and girls gave their lives in the 10 or so years we were involved in that. But, Tom, what I believe to be even more of a tragedy is this. That's the same number, 58,000, that die in the United States just from heart attack and stroke. Look at this, every 5 weeks.
Yeah.
Every 5 weeks we have another Vietnam War in the United States.
Yeah.
And then...
If you don't look at those numbers that way, though, it's just, people don't, unless they hear that. That's
right. And then 5 weeks later it happens again.
Yeah.
And then 5 weeks later it happens again. And so... often, people used to write that off as old age. He was 90, so he had a heart attack. He had a good long life. Yeah, but what if you're 45 and you have a heart attack?
Exactly.
That's not a good long life.
Right.
And we're seeing that go up now in younger people as well. Tom, do you know 1 out of 3 kids is overweight now? 1 out of 3 kids.
Yeah. Yeah. Do you think a lot of that has to do with the type of food and the processed food that we eat today? And
some, but also you and I, when we were young, we were told to go out and play.
Exactly. Right. Yeah.
And come back for dinner time. Right.
Exactly.
Yes. And now they stay inside often, and they're just using their fingers, and hardly anyone has fat fingers in America. Have you noticed that?
Yeah.
But everything else is a problem. So, it's activity, but it's what they're eating as well. And, of course, that's partly, or to a large degree, the parents' responsibility, isn't it? While they're under their roof,
Correct.
That's kind of their responsibility.
Yeah.
There's no easy answers, but 1 out of 3 kids is overweight now. What does that mean for the next generation? Because you and I remember there used to be a chubby kid in class.
Yeah.
Now a third of the class is chubby.
Yeah.
What's that going to look like in 10, 20 years?
Yeah.
So we're heading in the wrong direction. So the question is, what's going on here with all these stories that we talked about, all these men and these women? How can, in a country with the best medical care available, how can all of these people slip through the cracks? Well, we used to think that if you got your cholesterol numbers under control, everything was fine. And that's very good advice. If you go to a physician who says, I want to measure your cholesterol, well, you're practicing 1985 prevention. We know more than that. You probably don't have this cholesterol issue under control. May I boldly say, even if you have a cardiologist, because most people don't go to a cardiologist until they have an event. I'm trying to get a little bit more proactive than that. So it helps if you do all these things. You don't smoke, you eat right, you exercise, you maintain a healthy body weight. Nevertheless, still, everybody listening to this program, your chances of dying from a heart attack or stroke are greater than any other cause. So for men, once you reach 40, 2 out of 3 men will have cardiovascular disease. 2 out of 3. Ladies, half of you will. 1 out of 2. And the average years of life lost is 17. What could you do with 17 years? Especially, when does that happen? It happens usually at the end of life when you paid your dues, you raised your kids, you got some money maybe, you want to retire, and then gone.
Yeah.
So my dad missed his granddaughter, never met his granddaughter, never got to see his daughter grow up. The best years, he died 6 months before his retirement. He worked in a factory for 30 years and then died. And so all that money for Social Security, he never got any of that.
Never got any of it, yeah.
So this is just from an economic standpoint, not to mention the personal aspect of this. We want to keep those 17 years, not lose them. So your physician may measure things like cholesterol and triglycerides and the good and the bad, LDL, HDL, even things like C-reactive protein, which measures inflammation. That's good. Particle size and number of the LDL, a little bit more advanced, good things to do. Blood pressure. 1/3 of people have it in America, have high blood pressure. 1/3 don't know they have it. That's a lot of people.
It's a lot of people.
That's a lot of people. And by the way, Tom, the current and best standards is below 120 for the top number and below 80 for the bottom number. We don't have such a thing as a little blood pressure. I've got a little touch of blood pressure. No, you have high blood pressure or you don't have it.
Yeah.
And that top number needs to be below 120 and the bottom number needs to be below 80. And if it's not, you need to do something to make that happen. Salt is an issue for some people, but not a lot of people. Extra pounds on your weight, on your body, that's a big one right there.
Yeah.
Yeah. So let me bring you up to 2026. Here's where we are right now. You got 60,000 miles in your arterial system. I can't fathom what that means, but most of it is the smaller vessels called the capillaries. That's where this 60,000 miles in the human arterial system. Think about that. And if you have disease in one part, you have it throughout. Yes. So here's what we used to think, really important, and this is good that we have a graphic, that visual that people can see. Here's a side view of what a clean artery looks like when you're a kid. We'd like all of our arteries to look like that and look like that for our whole life. But what we used to think, you ate a lot of eggs, you ate a lot of cholesterol, then it clogged up like that. Yep. And you had all your blood could go through that little hole. Obviously, that's going to increase blood pressure because you make the hole smaller.
Exactly.
But what we now know, Tom, is that only happens in 15% of the cases. We now understand that most people that have a heart attack or stroke have clean arteries 1 minute before it happens. That's a change in attitude right there. That's a paradigm shift in our understanding. We used to think your arteries got filled up slowly with fat and cholesterol, and then you had a heart attack when you couldn't get blood through anymore. That only happens in 15% of the cases. In 85% of the cases, you have a clean artery 1 minute, and the next minute it's filled up. How does that happen?
Yeah, I'm curious.
Good. So here's a graphic depiction of your artery. You see different parts. The lumen is where the blood is flowing. This would be flowing out away from the screen towards you. You have a single cell layer called the Carotid Intima-Media Thickness. Intima is that layer that's between where the blood is and where the rest of the artery is. It's a single cell layer, Tom. One single cell layer thick. It's called the endothelial layer. And that separates the blood from the rest of the muscle here. And what we now understand is the disease, the plaque that causes heart attack and stroke, happens in the artery wall decades before it starts interfering with blood flow. And if it should break and go through that single cell layer that's right there, the body will see that and try to fix it with a blood clot. And 1 minute earlier, you were clean, and now you're filled with a blood clot. And that's why Tim Russert can pass a stress test and die 6 weeks later from a heart attack, because nobody was looking in the artery wall. That's what the new technology can see now.
Okay.
All right. So this is a actual histology slide of someone who died from a heart attack, and you can see pretty clean artery, right?
Yes.
Blood is flowing. There's no big impediment there.
Right.
But all of this that you hear, the red is the muscle layer, okay? And all you're seeing here now is what's called plaque. The brown part there, the brownish gray part, that's plaque. That's disease. And I'm going to blow up where you see the red asterisks right here. I'm going to blow it up with a closer view. And this is new plaque, what we call soft plaque, very dangerous plaque. A lot of this here, the brown, has calcified. The body has healed it, so it's not so dangerous. But it all started out as this soft plaque to begin with, and that's like a pimple in your artery wall.
And that's the part you don't want to start leaking in.
Indeed.
Yeah.
And so that's made up of macrophages and white blood cells and cholesterol. It's a metabolic mess, and it's a ticking time bomb. If you're lucky, the body will heal that and calcify it over time. But many people aren't lucky, and for any reason, a number of reasons, this single cell layer here breaks. That pimple will break. The body will try to fix it with a blood clot, and if it happens here, it's a heart attack. If it happens up here, it's a stroke.
Yeah.
What causes that single cell layer to break? High blood pressure can do it. High cortisol from stress levels can do it. Low vitamin D levels can do it, which a lot of your listeners have, low vitamin D levels. And the average American diet, processed diet, can do it. A high sugar intake will do it as well. Nicotine will do it. So there's literally tens and 20s of things that you can do to break that single cell layer there that's separating you from an event. So here you can see what actually happened. So here is where the artery hole was, and the blood was flowing. Here you can see the old line. You see the old where the endothelial layer was.
Yep.
There used to be that pimple in here. It's gone now. It ruptured. The body fixed it with a clot. This is all clot now here that you're seeing. Part of the clot broke off, went down to where the artery got narrow, and it couldn't go any farther, and that killed that individual. And that happens in 85% of the cases. And that's why we need more than the traditional medical care that we currently have now, because they don't look where they're supposed to be looking. So most cardiologists today are what we call luminologists. They're looking at the lumen. They're looking where the blood is flowing.
Yeah.
Better will be the doctor of the future, which is called an arteriologist, who's going to look at the anatomy and physiology of the artery itself, not just the hole where the blood is flowing. So standard care versus optimal care. What we want for all of your listeners is optimal care. What they're getting right now is standard care. Current standard care is based on something called the Framingham risk. Framingham, Massachusetts, they've been doing studies on these people for generations now, and we've learned a lot. We've learned, for example, that your diet has an impact on your health. We didn't know that 60 years ago. We found out that smoking is bad for your heart. We didn't know that 60 years ago. Well, we've learned a lot from the Framingham study, and that's still the current standard. But it's based on a population, and optimal care is based on individual. Statistically, Tom, I can tell what's going to happen to you because you are, what age, 62, did you say?
63.
63-year-old male. I know something about you. I can make some statistical predictions. But that doesn't tell me about you as an individual, because I don't know your blood work. I don't know your exercise. I don't know anything about you. So better is individual risk. So here's the current standard of care. Let's say you're a 50-year-old male. You don't smoke. You have normal cholesterol. You're not overweight. You eat well. You exercise. Your odds, statistically, based on Framingham, of having a heart attack over the next decade is 4%. If we took 100 men, 50 years old, doing everything right, statistically, only 4 out of the 100 over the next decade will have a heart attack or stroke. Okay, well, you go to your doctor with that, he's going to say, keep up the good work.
Sure.
I'll see you in a couple years.
Yeah.
Yet everyone has heard of people that did everything right.
Yeah, exactly.
Like I told, like your friend, right?
Yep.
Yeah. Okay. And again, the wrong response to that is, well, I guess you never know. No, we do know now. So we can do better than that. They did a study to determine whether the Framingham risk score would be predictive of somebody having a heart attack or stroke. So they took 222 adults who had already had a heart attack or stroke. The men were 55, less than 55. The women were less than 65. So those were pretty young heart attacks in these men and women. And they looked at these people who had already had a heart attack, and they put them into the system to see if the system would predict them. And the National Cholesterol Education Program missed 82% of the women, and it missed 66% of the males. They were told they're okay and that he had already had a heart attack or stroke. By the way, if a man is needing an erectile dysfunction medication, Viagra, Cialis, like that, and he's relatively young, 40s or 50s, according to a publication almost 10 years ago in Circulation, twice as likely to have a heart attack or stroke, not because he's taken the medicine, but because he needs the medicine. Yeah. Exactly right. So a lot of people that are taking ED medications, a lot of men think they have a sexual problem. In many cases, they have a vascular problem, and it's a red flag their body's trying to get their attention to. By the way, Food and Drug Administration recently said never mix Viagra for ED with Rogaine for hair growth. Otherwise, this could happen right here. So
there you go.
There you go. I thought I would just relieve the tension a little bit.
Yeah.
We're talking about a very serious topic here. We really are. Yeah. So that brings us to the test that we're bringing to the villages.
So ED needs you need to go see the MD because likely there's some other issues there.
Indeed, yes. Yeah. And if you do go to that MD, in all due respect, they might not give you the right test.
Yeah, you
might be told everything is fine.
Yeah. How many doctors are aware of the new testing technology?
There are about 200 physicians in the United States. Can you believe that? 200 physicians.
That's a pretty small number.
Practicing what I call aggressive prevention. I work with a couple of them. And I'm not a physician, by the way. I have a master's in nutrition. I'm a registered dietitian. I'm what's called a preventionist. And insurance doesn't pay for preventionist. No. But if you have a heart attack or stroke, they'll cover that.
Yeah.
They will. So the test is the Carotid Intima-Media Thickness test. We call it the CIMT. And why your carotids, if we're interested in your heart? Well, less invasive to look at your neck arteries. There's no radiation involved. It's easier to get to. It's not expensive. And again, false negative. In other words, if you're told everything's fine, but you're not, only a 5% chance of that happening because there's a 95% correlation because your arteries are your arteries. If you're clear up here, you're clear down here. If you're diseased up here, you're diseased down there.
Yeah.
So that's why we like doing it. Just to give you an example, Tom, this is what an ultrasound of your artery. And by the way, ultrasound has been around for 20 years. They've been looking at your neck arteries, but this is new software and new technology that has not been available recently. This is the old technology. If you would look, you can see pretty clean, right? That's a clean carotid artery.
Looks like the like Hormuz.
Exactly right. Well, ideally. But now, do you happen to see this little thing right there? So let's see what the CIMT sees. The CIMT sees this pimple on the side here, and you've been told everything is fine with the other technology. And here it is just sitting there waiting, not impeding blood flow. And if you do the old technology, you're told everything is fine, when in fact you're not.
So when you find this we're gonna hopefully get to this.
Yeah.
What do we do?
So let me just go through. Here's what the test looks like. It's a simple ultrasound, takes about 15 minutes. By the way, I will tell you, a lot of people have had a company called Lifeline Screening, which is a good company, been around for a long time. They travel the world, or America at least, and they do something on the neck, ultrasound too, but it's called the Doppler, and it's looking at blood flow. And that's not up to date. It's okay if you have a big blockage, they can find that. I'm interested before the big blockage happens. Yeah, that's right. So just so people understand, this is not Lifeline Screening. This is something, in my opinion, that's better. So what do you do about this when you get it? So first of all, you have to have a physician that knows what they're seeing, and most physicians won't know what to do with a CIMT. Honestly, we tend to do what we've always done. Change is something a lot of people don't like, physicians included. And so, no, your blood work is fine here, and you passed a stress test, and I think you're good to go. You don't have diabetes, and so come see me in a couple years.
Yeah.
And then I'll tell you have diabetes.
Yeah, that's right.
So we got to be a little bit more assertive. And again, this is not a program to slam the medical community. They are well-meaning, well-trained, the best in the world, but everybody doesn't keep up all the time. And in this area, you can't be practicing 10-year-old medicine. We got something better.
Right. Well, just look at AI. We have, in the last 2 years, every one of our lives has changed in being able to get access to stuff that it would take years to do.
That's right.
Now we have it at the touch of our fingertips. Obviously, the medical field is the same way.
They are, and they're actually using AI now to look at your vascular system, which is wonderful. It's a combination of something they've been doing in the past with AI now. However, it's about a $3,000 or $4,000 test. and you get the test done locally, but they send the results out to Los Angeles because that's who's actually doing the AI application of all this. So for a couple $1,000, okay, or the CIMT is $225. So it's a much easier thing. And I can go to the people instead of them reacting once they've had, because again, most people won't take any action unless they have symptoms.
Right.
Yeah. So let's see if we can do that beforehand. So what do you do when you get it? Well, a statin is probably going to be involved, and a cholesterol medicine, a statin. And a lot of people don't understand that a statin really is not to lower your cholesterol. That's what they gave it for many, many years. We know its real benefit is as an anti-inflammatory. And inflammation is the foundation of all kinds of diseases in the body, vascular disease as well. And if you have high blood sugar or high insulin levels, your arteries are on fire. They're inflamed. And we've got to get that down through lifestyle, changing your diet, exercising, losing weight. But a statin, a cholesterol medicine, will also help bring that fire down as well.
A lot of people have, I've never been on a statin, so I don't know, but a lot of people have complained of joint pain and different things where they're on there. Have they made improvements in statins?
Well, they've come out with different brands. So I agree with that. And some of them, like the first one that came out, Lipitor, is known to increase diabetes risk, especially in women. And so you got that side effect. And then you got the muscle aches and the joint pain and something like that. And so a high percentage of people that go on cholesterol medicines are off of it within a year because of side effects. So I take one. It's called pitavastatin, P-I-T-A, pitavastatin. The brand name is Livalo, L-I-V-A-L-O, Livalo. And it is the best for not having side effects. Most people can tolerate that. That's the one I take. And your side effects go up the higher your dose. And things like Lipitor, you tend to have a high dose. My statin, Livalo, I only take 1 milligram a day, a tiny little pill, 1 milligram, and I don't have the muscle aches and everything I did with Crestor and Lipitor and some of those other ones.
And I'm assuming the sooner that you know that there's an issue, probably the smaller dose you'd be on.
Correct. Yes. Yeah. Yes, that's right. Yeah. But also it depends on the brand that you're taking, because my Livalo is a stronger, more effective than some of those earlier ones were. So we don't need as much of a dosage as well. So I would encourage people that in spite of the side effects, and you don't have to tolerate side effects, try a couple different brands and see which one works best for you. But in spite of the side effects, the research is very clear. Yes, there may be increase in some issues, but the dramatic decrease in having a heart attack or stroke is well worth the balance of the benefit to risk. Well worth it. That's why I take one.
And I'm assuming that that as technology increases and as things go, there'll probably be more advances in those type of medications as well as time goes on.
Indeed. But remember again, the medicines are after the fact.
Right.
I'm still interested in what's causing this. And it's not your cholesterol level. That's a player, but it's not the big issue. We now understand that the big issue is your blood sugar and insulin levels are too high. That is the main driver of heart disease and stroke. And that's brand new news to a lot of people and probably some physicians as well. But the science is pretty clear. You get that blood sugar that's too high, you got causing inflammation of the vascular system, and then that's going to allow the plaque to form and to continue. So we've got to get that under control. Do you have prediabetes? I have it. Many of our people listening today have it and don't know it. How can you tell? Real simple, Tom. It's a simple formula. You take your triglycerides. Most people will have that in their blood work already. Your triglyceride number. You divide it by the HDL. That's the good cholesterol. Triglyceride divided by your HDL number. If it's 2 or above, you probably have prediabetes. You probably have what we call insulin resistance. So everybody listening or watching to this podcast, that's one of the most important takeaways from what we're talking about. Find out, first of all, if you have this. If you have it, that tells me the disease is probably going on right now. So
if you know you have the disease, and we talk about, like I said, a medication that you're going to get on, a statin.
Yeah.
What other things does... Yeah. Where do we go from there?
Okay, so now I need to go back again to the foundation of why do you have the disease? And again, blood sugar, where are you? Are you pre-diabetic? Probably.
Yeah.
Probably. Half of America, adults is. So if that's the case, what are we going to do to control that? Well, are you carrying some extra pounds? Well, we got to take those extra pounds off. By the way, Tom, a lot of people are surprised to find out. They think, well, I weigh 400 pounds. I got to get back to my high school weight. No, you don't. The research is pretty clear. If you will lose 5% of your current weight, we can see a drop in blood pressure, decreasing blood cholesterol levels, all kinds of things start happening in the right direction just with a 5% decrease loss. Yeah. So I encourage people, you don't have to get to the goal overnight. As a matter of fact, you don't ever have to get to the goal. Just be heading in the right direction. Yeah. You will get benefit from that.
Yeah.
So we want to find out, okay, do you have the disease? Yes. Okay. Are you insulin resistant? Yes. Okay. What are we going to do about this? Well, we got to get that blood sugar and insulin level down. Okay. How are we going to do that? We're going to take some weight off. The good news is when you get your blood sugar under control and insulin under control, weight comes down automatically because insulin is a fat storage hormone. You will never lose weight if your blood insulin levels are high. Why are your blood insulin levels high? Because your blood sugar levels are high, because you have insulin resistance, which basically means the cells of your body are resisting the insulin that your pancreas puts out. And the pancreas says, oh yeah, watch this, I'll put more out. And finally the blood sugar gets in. But that high insulin not only tears up your artery walls, it's telling the body, store any calories you've got, because clearly it's Thanksgiving today, because look at all this blood sugar that's in there. He just ate a whole bunch of food. So put all of this extra calories you got, any calories, in fat storage. You'll never lose weight if you have high insulin levels. And again, hardly anyone measures insulin. You got to know if you've got insulin resistance, because that's the foundation of this whole thing. So
you hear that term insulin resistance an awful lot in weight, but weight management. Are you insulin resistant? That's I mean, the term is out there for sure.
Calories count, but it's not just simple as calories in versus calories out.
Yeah.
And probably know exercising is a pretty inefficient way of burning calories. You have to run a mile to burn 100 calories.
Yeah.
And you just had a candy bar. Well, that's 5 miles right there. So that's not the way to do it. The better way to do it is probably maybe eat fewer candy bars and make sure that you can handle the candy bar when you eat it. And those people
let your body do more what it's supposed to be doing instead of fighting it all.
Many people have metabolic syndrome, metabolic disease. Their body is not capable of using the food, specifically carbohydrates, as they were when they were 20 years old.
Yeah.
And so I don't eat many breads and cereals and pastas anymore, even whole wheat. I used to eat not white bread. I used to eat real nutritious.
Because it was healthy, right?
Well, it was at the bottom of the food pyramid. Remember that? That was supposed to and that's what they taught me in graduate school. That was really good for you.
Yeah.
And it is nutritious, yes. But if you have insulin resistance, you can't handle it anymore. So I eat far more protein and healthy fat now, and not so much carbohydrate anymore. That's all food is made up of: protein, carbohydrate, and fat. That's it. So you got protein, carbohydrate, and fat, and I decrease my carbs now, and I've increased my protein and my healthy fats, like avocado and olive and omega-3 fish fat and things like that.
How long's the book been out?
About 2 years.
Okay. And this is not your first book. How many books have you written?
I've written 5 altogether.
5. And this, you seem to be on a mission with this one.
Well, I am. It hit me awful hard way back almost 50 years ago. I can't believe my dad's been gone almost 50 years. I've learned some things in those 50 years, and I'd like to take a little bit of credit, because in 2 months, my mom will be 100 years old.
Oh, there you go.
Yeah. So I've learned some things in those years and have tried to help my mom along the way. And hopefully, for myself and my family and the people listening too, we know a lot. One thing we cannot prescribe is personal responsibility.
Yeah.
That's the individual. But at least my job is to educate them. I don't take credit if they turn their life around. They did it. I didn't do it. I just educated them. I also don't take blame if they don't turn it around either, because it's not my responsibility. It's their responsibility.
So the CIMT test, you're going to be testing all day on May 28th at the Holiday Inn Express in Lady Lake.
That's right.
And they need to get in touch with you
beforehand
to schedule it.
Yeah, you have to schedule it. Yeah, it takes 15 minutes.
And the cost is
$225.
$225.
Yeah, it is not covered by insurance. It's prevention, as we said.
Yeah.
If you have a heart attack, your insurance will cover that, however. So it's the irony of the healthcare system, isn't it? But I think most people can see the value of the choice.
So take me through this. If someone showed up and they got a test and they got the results and it's not favorable, what's the first thing? Where's the first place they need to go after that?
So as part of what they're going to get, they'll get the official report. It will show them the condition of the arteries and where the blockages, et cetera. But then also they're going to get a 4-page letter from me by email that turns this into lay terms so they can understand what this medical thing looks. This is a medical grade test reviewed by radiologists. This is legitimate science. And then they'll get a 4-page letter from me saying what this all means. And then they get access to 4 hours of video with me and the physicians that they can watch at their convenience, really going a deep dive. I mean, it's 4 hours of content. They'll know more than many physicians know by the time they're done with this. If at that time they say, you know what, I want to do something more, we have a full year program, and I'll put them in touch with the physicians. Again, of that group 200, I work with a couple of them. This is all by telemedicine. There's nobody in Central Florida that's doing this, but it's because of COVID. That's one good thing that came out of COVID now.
Right.
You can get medical care from the real people that you need to see, and you can do it from your home.
Yeah.
And so we'll put them into that program. This is a premier program. This is, this is a high ticket item, but we're talking about a year, and we're talking about having physicians working with you one-on-one, and advanced blood work and genetic testing. And the CIMT is just the first step to find out where you are. So if I may say so, it's one of the better programs out there right now. And we're bringing it right to the villages so people have the first step.
What's the cost of the program if they do get into the...
The whole program is $8,500 for the whole year, but that includes all the blood work and all the genetic testing and seeing the physicians. It's a complete package.
And that is not covered either by insurance?
No, that's not covered either.
Yeah, but but it's crazy. But they'll cover $1 million open heart bypass surgery or whatever that costs. I have no idea, but...
And I think most people listening, I mean, if they've stayed with us this long in the program, they're clearly interested in this topic.
Yeah.
I think they can see the logic. I mean, I tell people I have car insurance in case of a catastrophe.
Correct.
But they don't pay for my oil change.
Yeah.
And they don't pay for my tires.
Yes.
That's prevention.
Yeah.
And so why would I submit a new tire bill to my insurance company? That's not what they're there for.
Right.
And so we're used to in this country, well, does insurance pay for it? No. Well, then I'm not going to do it. Well, that could be a real dangerous attitude to have. We got to be more proactive and change our own oil and change our own tires so that car will be with us another 20 years.
What's the outlook on getting more people in the medical field familiar with the CIMT test and doing it?
Oh, I think it's happening. It's been around for a while. I will tell you the CIMT originally had some negative research on it because they couldn't consistently put the results in a way that were repeatable, because it's very dependent on the technique of the technician and the software that you're using. Because when you're looking here at the carotid arteries, when you're looking at that wand, if you come in this way instead of this way or that way, you're going to see different plaque in the artery. And so there wasn't a consistency. When the people would report, they do scientific studies, and they said, no, we didn't see, it was not predictive of all. But then you look at another study, yes, it was very predictive. So there was no continuity and consistency of testing. Now there is. And the company that I work with, I fly the people in. I'm not trained to do this. I'm an educator, but that's all they do. And what you want to be careful with is going to someone that does a CIMT once a week or so at a doctor's office. That's a little bit, these people do this all the time.
Yeah.
And we've done over probably 1,200 of these. And so we're pretty good at the technique, which is very important for the reliability of this test. And so in the beginning, they published these studies, and the doctors would look at these studies and say, oh, CIMT doesn't work, or it does work, and I can't depend on that. So right now, many physicians, if they've heard of the CIMT, they've dismissed it based on 10-year-old data.
Sure.
It's much better now.
Yeah. So it's still very reasonable. $8,500 for, look, if you take this $225 test and you see things that you didn't know about. Let's just say that you lived another 20 years because you went through that. That's a really small amount of money per year.
And quality years, too.
Correct.
You didn't
Yeah.
have a stroke, even if you
Yes.
did live 20 years.
Yeah, like I said, there are worse things than dying, and having a debilitating stroke is awful for yourself and those around you who are, obligated to take care of you, et cetera.
Yeah.
So,
Tom, I will also mention, too, if people are interested in any of my books, they can just go to the website booksbydavid.net, booksbydavid.net, and all my books are available there if they like to get the 10 bonus years or something else. And they give you a good deal if you buy I have a couple of different titles out right now. So booksbydavid.net is a good place to get that. And again, I will be teaching in January again of 2027. That course, 10 bonus years based on the book, will be announced in the Enrichment Academy catalog that everybody gets. They come out with that probably in November, December.
now, do you give the test to people in that Enrichment Academy, or?
Well, I mean, I can't really promote anything in the Enrichment Academy, so I let people contact me if they want the information. So that's as far as it goes. But here, we're talking when people can know about it. But in the limitations of the class, I'm not allowed to sell or promote anything. So I just tell people if they want the test, they have to contact me, and then I give them the information.
On a day like May 30th, or May 20th, how many of those tests will you do in a day?
Well, ideally 30. That's about all we can handle. We need 20 at least, but 30 is probably our maximum. So I would encourage people, if you can give them the phone number, or I guess we haven't done the phone number yet.
No, but we'll get that on the screen.
Yeah. So that phone number, they need to call me because that's coming up here in a couple of weeks there, and we need to reserve their place. Again, it only takes about 15 minutes for the test. The results come back in about 3 weeks.
And age-wise, there's no age for taking this test.
There really isn't. Like I gave you that example earlier, that young guy, he had disease already in his 20s.
Yeah.
And so, now, if somebody's already had a heart attack or stroke, they probably don't need this test because we know they already have the disease, right?
Yeah.
The benefit, though, would be for somebody like that who thinks they've got everything under control because they're on a medicine, whatever it is.
Yeah.
But if they got that soft plaque pimple still forming in some of their vascular system, that tells me they don't have it under control, and they need to take more aggressive action on this. So even for somebody that has a heart attack or stroke already, maybe this does have a place.
And if you have your parents, your grandparents, stuff like that have had cardiovascular issues, would that be a good recommendation?
Absolutely. Yeah. Like we said, there's a genetic component to this. And so it can run in the families, but it seems like if you're part of the American family, you're at risk.
Yeah. Well, I'm part of that. I mean, both my parents have had cardiovascular issues, and my dad's parents, brothers and sisters all have. I'm going to sign up for that test.
Good. Glad to have you. Yeah.
So,
and if anybody's listening, if you decide you want to come, you call the phone number that we're going to provide for you. But if you have family or friends or whatever, tell them about the program. Can they pull this program up to watch it at a later time, or how's it available?
Oh, absolutely. This will be available on YouTube forever.
Okay, good.
Yeah.
So tell them to watch this. And again, we need 20 to make this event happen, and we can handle about 30 for the day.
All right. Well, you heard it here. David Meinz, this is a great CIMT test. This is not brand new, but fairly new.
New to this area.
New to this area for sure, and it certainly sounds like something worth doing. $225. I mean, we can spend that easily out at a restaurant here in the Villages on a good night. So, money well. I'll tell you what. I'll tell you how well the money is spent because I'm going to take that test. And David, 10 bonus years, your book. Probably I need to read that book because again, I want life to my years left, and I want a lot of years left.
I'm not promising immortality.
Certainly, we are still going to die.
But too many people die too young.
Yeah,
and they start dying 10 years before they ultimately go away.
Yeah.
That's no good. What we want to do is not necessarily expand lifespan, though that would be nice. What we want to do is expand health span so that your healthy life goes on and then it goes down quickly. That's the way I think most of us would agree. Yes.
Yeah. When the tank is empty, that's it. But there's no sense in running
on empty.
lousy for many, many years. So
that's it. Well, that's part of what the Villages is all about, isn't it?
It is.
I mean, I think I've heard somebody say that the Villages can add maybe 10 years to your life. Yeah.
Yeah. I believe that. I believe that to be true, and this could add 20.
It could. And, one of the things that people are saying is that the importance of community. And like you, I've worked for myself my whole life.
Yep.
And so I didn't work for a big company. I traveled the country and some internationally doing seminars on health. And so I got 1,000 people in front of me, and that's good. But then they all go home, and then I go back home to my apartment or my house. And it's a lonely job to be somebody that works for themselves, And so I'm also thinking about moving to the Village as well. I live in Orlando right now, still working, but I'm looking at coming up here because of that community aspect. I already have Central Florida. I already have good weather. I'm not coming from Ohio.
Right.
But this is what's drawing me here. And that's one of the things we talk about in 10 bonus years is the importance of community. So if somebody's listening in the Villages, you've taken care of one of them already. Yeah,
I 100% believe that this adds 10 years to your life. My parents have been here 25 plus years. And so I've been a believer for a long time. My wife's wanted to live here for the last 25 years, but you have to wait till you're old enough to come here.
Yeah.
But no, everybody, this is about lifestyle. This is about exercise, activity, being with people like-minded, and staying healthy is it's on a lot of people's minds, and I'm not sure that everybody knows. I wouldn't have known about this until you came on the show. I heard a little bit about it from somebody who directed you my way, but It was very, very interesting and certainly well worth $225 in 15 minutes of my time.
And you don't want to do everything right, community and, all of the things you're doing right, and to get cut down by 17 years because you didn't know what was going on inside your body.
Right. Good enough.